My name is David Johnson, and I am an advocate at the Center for Advocacy for the Rights and Interests of the Elderly, or CARI. If you are someone that has both Medicare and Medicaid, or if you are 21 and older and receive care and support at home, in the community, or in a nursing home paid for by Medicaid, you have likely heard about Community Health Choices, or CHC. Community Health Choices is a mandatory managed care program for certain adults in Pennsylvania and will change the way Medicaid benefits are paid for and delivered. I want to talk about how Community Health Choices will change access to Medicaid benefits and what will stay the same. For individuals enrolling in CHC, they will need to choose between one of three managed care organizations or plans. They are Keystone First, Pennsylvania Health and Wellness, and UPMC Community Health Choices. Outside of southeastern Pennsylvania, Keystone First is known as AmeriHealth Caritas. For those receiving Medicaid long-term services and supports, like a home health aide, service coordinator, or nursing home care, these benefits will now be administered by one of three managed care plans under Community Health Choices. This means that for Medicaid services, you will need to use providers within your plan's. There are lots of changes with Community Health Choices. That being said, your Medicare coverage and providers will not change because of Community Health Choices. You do not need to change your doctors, even if they are not in your Community Health Choices managed care plans network. Your CHC plan will help you pay for your Medicare out-of-pocket costs like Access does now. If you have Medicare and Medicaid, you will use your new managed care plan under CHC for Medicare cost sharing at your primary care physician and other specialists. Instead of these providers billing the state directly for services provided, they will bill your managed care plan, who will pay for costs not covered by Medicare. Instead of using your Access card, you will now have a new managed care card to show your doctors. For services Medicare does not cover, you must use a provider in your CHC plan's network. Some examples of these providers include dentists, personal care assistants, and home care aides. Make sure that they are in network with the CHC plan you choose. If you need to make a change in providers because your preferred provider is not in network, there are continuity of care protections in place to ensure that you have time to find a new in-network provider. You should have been getting information about Community Health Choices in the mail about the plans, their different added benefits, and information on how to enroll. The state makes all plans offer current Medicaid health services and long-term services and supports. So what are the differences between the plans? Each plan will have its own provider network, as well as some added benefits. When you are choosing a plan, you may want to consider some questions like, are my Medicaid doctors and providers in network? Do any added benefits in the plan benefit me? If I have just Medicaid, what prescription drugs are covered in each plan? If I have just Medicaid, what are the copays in each plan? Depending on your providers and your needs, one plan may be a better fit for you than the others. To enroll in CHC, you will need to enroll through the Independent Enrollment Broker. The Independent Enrollment Broker helps with choice information and will tell you which network doctors, specialists, hospitals, and other providers are in, as well as drug formularies. You have the option to enroll in CHC by phone, online, or by mail. Because CHC is mandatory, if you do not choose a plan, the state will pick a plan for you. Community Health Choices marks a significant change for a lot of consumers. Under CHC, consumers have rights that they should know about, however. Under CHC, you have the right to change your plan at any time. You have the right to keep your Medicare coverage, doctors, and providers, and you have the right to appeal the loss of care or care that is denied, and you have the right to complain without any problem. CARI recognizes that Community Health Choices may be a daunting and worrisome change for vulnerable Pennsylvanians. We are prepared to help. We can share easy to understand materials to consumers and professionals. Cary also has a helpline that is available to anyone who would like an advocate to take the time to talk about these changes, answer questions, and troubleshoot problems. Residents statewide are encouraged to call 215-545-5728 or toll-free at 1-800-356-3606. Anyone interested in staying up to date on the latest CHC information and advocacy tips are invited to join the Cary CHC Advocates Alliance. Stay tuned for more materials, and please contact us at Cary with any questions or concerns about CHC. We want to hear from you.